Hello, today I have my dad here with me and I'm going to be teaching you how to use fluconazole propionate inhaler. So, Dad, do you have any previous knowledge or background on why we use inhalers?
Well, sure. When I was a child, I had to get inhaler for my asthma. So that
Yes.
was a long time ago, and they were actually the thing I had was a spinhaler.
Okay.
It kind of actually crushed the tablet, and then you inhaled the dust. So it was kind of
Oh.
kind of nasty.
Yeah, well, so that's a little bit different. It's similar to this. So this inhaler is used for, as you said, asthma. So with asthma, basically what happens is that there's inflammation in your airways, and so it causes you to have difficulty breathing, and you might have shortness of breath or chest tightness or wheezing. Those are some of the common symptoms. But today I'm going to be teaching you how to use this lovely inhaler. So as you can see, it has a cap on it, which it will come in this box, and normally it can come with 200 to like 100 puffs. That's going to be per the prescriber's order and what your doctor would want for you. But basically, when you use this thing, so you have this actual canister here, which is at the top, and then you have the cap, which is where you put your mouth on it. So when you're actually holding the inhaler, you want your pointer finger on the top of the canister here, and then the bottom of your thumb down here with your mouth to the piece. And so when you do this, you have to make sure you want to shake it up because it is a spray form. So instead of having the tablets or dust, like you said with the inhaler you had previously used, this is just spray. But you have to make sure it's mixed up, but otherwise it's not going to get into your lungs really well. And so what you want to do first is you want to breathe out, and then you want to take a deep breath in and then squeeze the puff. And so the reason why we do this is so it can get into the deeper alveoli, which are the sacs in your lungs. So it helps with airway obstruction, opens up the airways and dilates them so you can breathe easier. And so one of the things though with this inhaler is that this is not a short-term acting inhaler, which means that if you're having an asthma attack currently, you cannot use this inhaler during the asthma attack. It's only to help prevent the asthma attack. So just making sure on this, there are probably some side effects that I would suggest to call your healthcare provider if you're experiencing dyspnea, any dizziness, mental status change, or if your asthma attacks or asthma is still really negatively affected, I would suggest calling your healthcare provider because then they need to switch your dose or get you to a different inhaler because this one's not working well. And one thing also that I want to mention is when I was telling you how you want to squeeze down and breathe in, you want to hold your breath for 10 seconds because we want to get to the deepest pockets of our lungs. Because if you just inhale and then release, and then inhale and release, you're not really getting the medication down deep into your lungs. So, do you want to help demonstrate with how you would use the inhaler when you're all puffing it in?
Absolutely, sure. So I would hold it this way, right? I would take the
Yeah.
cap off first, and then making sure my finger was on the top of the canister, I would exhale, squeeze down, inhale
The spray.
the spray,
Mm-hmm.
and hold it for 10 seconds.
Mm-hmm. And you would do that between each of the puffs. So for your medication, and I was looking at your order from your doctor, he said you would do 2 puffs every day. So you would want to make sure you do those puffs a minute in between each other. And you don't necessarily have to spread it out like having 1 puff in the morning, 1 puff in the afternoon. It would just be 2 together.
Okay.
But having a minute at least in between so that the medication will be able to distribute into your lungs. Do you have any further questions on the inhaler or any things, concerns?
No, are there any side effects?
So some of the side effects, of course, is it could cause dizziness, nausea, or vomiting, or you could feel a little lightheaded. Again, some people, they are allergic to this class of drug, which I did check your chart and it doesn't say you have any allergies, but if you have any anaphylaxis shock or any of the symptoms I mentioned where your allergies or the asthma is getting worse, making sure that you stop the medication and calling your doctor for a change.
Excellent.
All right, I'm glad I was able to teach you about this medication.
All right. Thank you, Sophia.